Hello, can you hear me? Hi. I was wondering if I can use the polling feature, if I can create a poll to make the session more interactive.
Hey,
Hi,
hi.
how are you?
Do you see on the right-hand side bar, do you see this polls um, option next to chat?
Yes.
Okay, so then that should allow you to create a poll there.
It says you can see polls here when your organizer adds one.
Oh, I did add you as a moderator, so you should be good. Let me just say this again. And then, okay, that should be there. Would you quickly, would you quickly mind like rejoining this if you know how to rejoin?
Yeah, let me do that.
Yeah, to see that you have all the privileges.
Hi, everyone. Can you hear me or see me? I'm going to share my screen.
I can hear you and see you fine. And I think you're able to create a poll as well, right?
Yes, I am able to make a poll, and I'm going to share my screen.
Cool.
As soon as I figure out how to do that, then I can get started.
So I'll be around for whatever help you need. Just give me a shout out.
I am unable to share my screen for some reason.
Do you see the button to share the screen next to the settings button?
Yes, but it's not letting me share.
Mm.
In the meantime, those who are attending the session, I thought I want to make this a bit more interactive. So I had put a question in the poll, and the question is, have you downloaded or and used a contact tracing app? Feel free to say I prefer not to say if you want to not share or not answer the poll. And some other sort of interactive questions that I want to pose to the audience are, one, what do you perceive to be the benefits of using a contact tracing app, if any? And the second question is, what are some realized or potential harms from deploying contact tracing apps? And then the third question is, what are some are the benefits and harms unevenly distributed amongst the public? If yes, how? So these are some questions to consider. And in the meantime, I'm going to try to figure out how to share my screen. So right now I can't share my screen because there is a slash across it. And when I click on the screen that I want to share, it would still not allow me to share. So that's what's kind of frustrating.
Oh, so when you click on it, do you see any pop-ups on the browser? Because like when I'm doing it, it gives me a pop-up saying which window or screen do you want to select.
Yes, it does.
And then you can probably like click on the drop down. There should be a drop down which should give you a list of all the windows and screens, and then click allow. Can you try that?
So when I do that, it just goes back to having a slash.
Oh, okay. Let me quickly try something. Okay. So I'm able to share screen, and I stop sharing it. I'm assuming the only reason this is happening is either because the browser is blocking something, but like I'll be the same steps. I'm clicking on the slash icon, the share screen, choosing a window. In this case, it's a Firefox browser, and then I click allow, and then you can share my see my screen. I'm assuming rest of the participants can also share my screen.
Yes, I'm using Chrome right now, and it's somehow not letting me do it. I'm sorry, everyone in the audience. Thank you for your patience. What should I do? Should I just start maybe doing it without slides? Can I do that? Maybe I can put the slides along in the chat, and then maybe you can follow along. Is that what are folks okay with that? So I have the slides in. I put it in the chat. So maybe you can follow along while I do it on my computer. Alrighty, so I'm gonna introduce myself. My name is Baobao Zhang, and I am an assistant professor at Syracuse University. And today I will be talking about why contact tracing apps failed and how we can reimagine the future of digital health tools, especially in a pandemic setting. I want to point out, this is joint work with my team, Sarah Krebs at Cornell, Lauren Weisinger at Tufts, Nina McMurray at WZB, Berlin Social Science Center, and Stephanie Neumeyer at University of Southern California. Okay, I'm going to try, enable screen recording privacy setting in my browser. Sorry, I just feel I'm doing a lot of different things at the same time.
Hi, Dr. Zhang.
Yes.
So just to quickly check, so when you actually try to share your screen, there should be a pop-up that appears on the top which asks for a permission to share.
I think I got that, and when I logged out, that disappeared. So should I maybe quit my browser?
Yeah, maybe you can try logging in again if you haven't tried that, and also trying like a different browser if you have another browser in your system.
Yes, I can do that.
And then also the security setting that like our SV just wrote in the chat, which says like screen recording and privacy setting for that.
Thank you so much. I'm sorry to everyone in the audience that this is.
Yeah, sorry about this. This happens, but yeah, we're trying to fix it as soon as possible.
Okay, I think this is working. Let me just log off the other one and make sure that I can share my slides. Can everyone see?
Yeah, I can see the screens.
Hi. Is it one screen or
I do see a Firefox browser, so I don't know if that's the screen you're sharing the slides.
Huh. I'm trying to share the full screen. Can you see the full screen or?
I see the full screen, but the screen has the Firefox browser with Hopin. I don't see the slides in the screen, if that's the screen you're trying to show.
Okay. Let me try again. Let me quit my other browser.
Yeah, you might just have to move the slides to that particular desktop screen that you were sharing just now.
I'm sharing it on a second screen.
Yeah, gosh. We see a screen with the background, no slides yet though.
Let me I moved it to the other screen, but it's not showing up.
Yeah, it happens all the time with when you have multiple screens.
Oh, there we go. I think it's finally working. Yay!
Yes, awesome, great.
Oh, I am so happy. Again, thank you everyone in the audience for hanging in there. I introduced myself, so you know who I am. I just want to say that in terms of what my team has been up to, and we've been working on various projects around public acceptance of new technologies, both pharmaceutical and non-pharmaceutical interventions that had been deployed in the COVID-19 pandemic. So we had worked on published papers related to various digital surveillance measures, also public acceptance of the COVID-19 vaccine, where we found actually those in the US were more hesitant about the COVID-19 vaccines compared to those who live in low and middle income countries. And we've also worked on contact tracing apps and sort of the ethics of contact tracing apps, and also how to build vaccine verification systems, both on paper and digitally. And today I sort of pose some questions, but I do want to get through the presentation. But if you have thoughts, please put it in the chat. I want to make this interactive. And there's also an activity at the end where I welcome your suggestions for how to think about how to anticipate the use of digital tools in future pandemics, because I think we can learn a lot of lessons from what has happened in the past 2 years. In terms of the outline of the tutorial, I'm going to give some background information so that everyone's on the same page about contact tracing apps. And then I'm going to give sort of 4 categories of reasons why I think contact tracing apps failed. This is not exhaustive. I'm trying to come up with some big themes. And if you have other suggestions, again, I welcome your comments in the chat. And then we're going to do an activity where we kind of try to come up with lessons for future pandemic preparedness, because I think that's really important. And as we know, as we've seen with monkeypox, unfortunately, pandemics are not just a one-off, once-in-a-lifetime scare for many of us, because given climate change and all this international travel, pandemics might become more common. So I'm going to give a brief background on contact tracing apps and sort of explain some basic background information. Some of you might already know this, so I'm going to go through it a bit quickly. So in terms of manual contact tracing, I think we're very familiar with it. It has been a staple in public health since the early 20th century. And here, we really need to rely on public health departments and trained contact tracers. When they get a confirmed case, they would reach out to the infected patient and get contact information of the potential contacts, and the contact tracer might go out and knock on doors or call people and tell these contacts to isolate or get tested. And there are some potential shortcomings with this method, although it has been deployed quite successfully in Japan in the early days of the pandemic, but it's not a huge success everywhere. And I just listed some shortcomings that other public health researchers have also identified, such as maybe you have a lot of cases and there are not enough trained contact tracers. There's a failure to reach the infected patient for whatever reason. Maybe there's a language barrier between the contact tracer and the infected patient, so they can't communicate. The infected patient may not remember all the people that they've been in contact with, and they may not want to give out the contact's information. This is, again, quite sensitive, private information. And finally, there are delays in reaching infected patients and contacts that could really delay the process in terms of getting people the treatment that they need or to tell them to isolate. And how digital contact tracing tries to get around this is really sort of taking away the role of human contact tracers to automate the process such that the infected patient can put in the app their status, which then instantly signals to potential close contacts to alert them that they might be infected. And so when these designers were coming up with with contact tracing apps, they proposed that digital contact tracing could solve a lot of the shortcomings that I mentioned earlier. For instance, contact tracing apps can be deployed at scale on smartphones. Not everyone owns a smartphone, but a significant portion of the population in many of these countries where they're deployed do own smartphones. Now, some apps can notify contacts without the consent of the infected patient. That's not necessarily a good thing, but it does overcome the failure to reach the infected patient. Apps can be deployed in several different languages. They can be localized. For instance, in New York State, the app that I have on my phone has, I think, almost 10 different languages. Languages that are more prevalent in immigrant communities, especially in New York City. Notifying contacts is automated, so you don't have to remember who you've been in contact with. And in some cases, with the privacy preserving features, there is a level where you can preserve the privacy of the contacts. And then finally, there's not as much of a delay because exposure notification is sent instantly to the contacts. So these are some good things that developers of contact tracing apps have mentioned, but a lot of the talk will focus on some of the shortcomings. Oops. I don't know why there's an animation on this slide. I want to talk about sort of the computing dimensions of contact tracing apps. So in the early days, a lot of these apps tend to focus on GPS or location tracking. For instance, GPS would say, hey, you've been at this particular location, but also sometimes they're supplemented by having QR codes at specific locations where you can scan the QR code and then it registers that you have been at this location, for instance, at a restaurant or at a music venue. And there, in these cases, if you do test positive and you notify the app, then all the people who've been in close proximity to you with these location tracking, they get notified. Now, there's obviously a lot of privacy concerns with GPS or even scanning the QR code location tracking because people could find out where you are. They could potentially identify you. And so some designers have proposed this alternative, the Bluetooth proximity tracing, which relies on Bluetooth signals sent between phones. So then you're not tracked to a particular location. And there it records these anonymized key codes that when your phone has been in close proximity to another person's phone. And that is how the contact tracing is done. I do want to point out that there is sort of another computing dimension to these Bluetooth proximity contact tracing apps, where there's two different types of architecture. There's the centralized architecture, where once you test positive and you alert the app, then your phone will send the anonymous IDs and codes of all the phones that you've been in contact with to the central server. And then the central server does the contact tracing and alerts the potential people that you might have infected. Whereas in the decentralized contact tracing architecture, your phone just sends your own anonymous ID to the central database, and then other people's phones will download regularly all the anonymous IDs of people who have tested positive and do the contact tracing locally on your phone. So the contact tracing is not done within the central server, which a lot of privacy experts have said that the decentralized method is less likely to be hacked and more secure and private for users. So that is sort of the background. Now, here are just some examples of apps that have been deployed in the real world that have these different dimensions. I want to get through all the slides, so I'm going to quickly move through to the next page. And besides the computing dimension, I also want to talk about sort of the policy dimension, because that can also have a major impact on both the effectiveness of these apps, but also on potential harms to users. So in most sort of liberal democracy countries, using the app is voluntary and reporting positive cases is also voluntary. But in some other countries, to give you some examples here, using the app or reporting positive cases, both of those are mandatory, which you might think is obviously the health departments requiring these say, it's for public health purpose, but also, in many cases, those who care about privacy and sort of misuse of these apps might say, hey, that's a human rights violation. So that's an additional dimension that I want to mention. So why has contact tracing apps failed? They haven't totally failed, but I'm sort of using this language because they haven't really become, at least in a lot of countries, not a prominent layer of the Swiss cheese model. So we all know to wear a mask or get vaccinated or open windows for ventilation. But I think in a lot of countries, contact tracing apps haven't reached the same level of prominence as these other interventions. And so I'm going to propose 4 reasons. And again, not exhaustive. If you have other reasons, please, I'd love to hear them. This is an ongoing project that my team is working on. And if you want to collaborate or give suggestions, I'm happy to hear them. And the first reason, I think, is sort of uncertain effectiveness at reducing COVID-19 transmissions. And again, this is a relatively new technology, right? So there's a lot of uncertainty whether it works or not. So when we consider, do these apps work? We have to consider it from both a technical standpoint and from a social technical standpoint. So from a technical standpoint, you might wonder, how precise can GPS location tracking be? Do the Bluetooth signal strength, does that correlate with distance between smartphones? So can you really use this to do contact tracing? And then when designers are creating these apps, and then public health authorities are sort of setting the parameters, right? Are you doing it at 2 meters for 15 minutes? Setting these parameters mean changing the false positive and false negative rates, right? And that also has an effect on how these apps work. Now, we also have to consider these apps from a social technical standpoint, given that you really need a substantial number of people to use these apps to have it be effective. So you might want to consider, like, what percentage of the population has smartphones that are compatible with the app, and what percentage of the app what percentage of the population needs to use the app for it to be effective. And then finally, a lot of the early studies were based on game theoretic models, taking in certainly real world demographic data. But now that these apps have been deployed for a year or more, do they actually work in the real world, right? And so unfortunately, there's a lot of uncertainty from both the technical and the social technical perspective. For instance, GPS location tracking might not be precise enough for contact tracing. So this was a study that was done by engineers before the pandemic, and they found that GPS location tracking actually has some error rates, 7 to 13 meters, which is not really precise enough for contact tracing if you're thinking about sort of what a close contact is. And things like being in proximity to a large building can increase these error rates. And then Bluetooth proximity tracing, which is more focused within the 10-meter range, that also has some engineering challenges where tested in real-world settings on this tram, but also in different locations. This team has done a lot of tests of using actual phones in different real-world locations, have found that Bluetooth proximity tracing is also not as precise as we want it to be. Looking at this graph, there's not necessarily a perfect correlation between the attenuation of the Bluetooth signal and distance, and also the sort of relationship between attenuation and time really, and distance, it doesn't necessarily follow this linear relationship, and there's some weird discontinuities. And finally, in terms of setting the parameters and testing it in a real world setting, this team actually found that the Swiss and German detection rules triggered no exposure notifications in this test, while the Italian detection rule generated a true positive rate of 50% and a false positive rate of 50%. So as you can see, setting the parameters of the detection rules actually matters a lot for whether you're able to pick up contacts. Now, moving on to the social technical dimensions of contact tracing apps, I'd just like to point out that a large percentage of people do not own a smartphone. So in the most populous countries in the world, say in China or India, it's a substantial minority of people, or in India, a majority of people don't own smartphones. And even say in the US, it's not 100%. So that's another consideration in terms of thinking about equity. So and looking beyond just sort of the national level numbers, we might want to consider, say, within a country, who are the folks who don't own smartphones. So I live in the US, and most of my team's research is based in the US. And so one of the things we really identified early on was that populations who are most vulnerable to COVID-19, for instance, the elderly and those who essential workers who can't work remotely might not be the target population for these apps. So just give you some demographic information. 85% of US adults report owning a smartphone. Again, not all these smartphones are necessarily compatible with the apps because they require sort of newer, fancier smartphones. But looking at the demographic data, those who are elderly, those who have lower levels of education, or those who are making a lower level of income in the US own smartphones at lower rates. Now, there are some proposed solutions out there to help people who don't have smartphones. For instance, Singapore's Trace Together program, which is a Bluetooth-based contact tracing program, has given out these digital tokens that can act as, that can emit and detect Bluetooth signals as sort of alternative to people who don't necessarily have smartphones. But I think some of the privacy concerns still remain when you have another technical solution. Another important social technical dimension that I want to mention is that effectiveness increases with user uptake. In the beginning of the pandemic, there was a quite influential study that came out of Oxford with Christoph Fraser's group that a lot of papers, popular media quoted that you need 60% app usage in the population to have this contact tracing method to be effective, but that's actually not the case. So you can still reduce infection rates with a lower percentage of app usage. Although this is sort of done through modeling, a lot of the early work wasn't using, real world data in terms of whether people actually use the app or not. So this is just to say that yes, if we can get to 60%, that would be great. But even at lower rates, in some modeling studies, even 15% can cause a substantial reduction. Now, the thing to look back on now that we have real world data is, can these apps be effective in the real world? And there have been many studies that come out. So I'm going to highlight sort of two contrasting studies because they're sort of a bit all over the place, given how different the experience has been for people across different countries. So in the real world, I think digital contact tracing can be effective if user uptake is high. And so the England/Wales NHS app has been cited as a success story. So there was 6.5 million users, so it's about 28% of the total population. And the app sent out 1.7 notification exposure, 1.7 million exposure notifications, and may have averted over 600,000 infections within, say, I think 9 months of use. So it seems quite effective. And this app, had a very high uptake, but also had easy to use features so that even people who are taking lateral flow tests, those rapid antigen tests at home, can get a code to notify the app that they've tested positive, which is not the case in many other countries. Again, contrasting with my user experience in New York State, it's actually quite difficult to even notify the app if you've tested positive because you require contacting various local public health officials to get a code. And so, again, with these different effectiveness estimates, it really depends on how the app had been designed and deployed. So I'm going to give you a different case looking at the app that was deployed in New South Wales and Australia, where it was not a success, where first of all, they had very few cases because of more strict COVID lockdowns and more interventions. And so what they found is that actually the app only detected 17 additional close contacts were not identified by manual contact tracing. So although they, the government spent substantial resources to develop this app, it was not a success. And to quote from the paper, COVID safe generated a substantial additional perceived workload for public health staff and was not considered useful. Again, a few reasons why the problem was uptake in this area was not very high. So even if you notify the app, so 22% of the cases, they notify the app, but if other people are not using the app, then they're not going to get the notifications. And here, manual contact tracing was much more effective at notifying those who might be potentially infected. At this point, I'm trying to do a bit more participant engagement. So I'm going to ask you, what trade-offs do you see between these different designs and policies? I'm just curious to hear your thoughts. So I've talked about the different architecture, mandatory use / reporting versus voluntary. If you want to put it in the chat, or you can also speak. I think there's a button where you can press to speak. Kimberly? Oh, sorry. I have to add you.
Oh, there I am. That's good. Well, thanks for all of that. Yeah, it's interesting, isn't it? I know that it's just based on my experience of all of this in Australia, because it was almost, like almost entirely voluntary. The problem with the voluntary was it was so very privacy respecting, but it almost it really meant that no one really saw the point, because the trade-off was you just couldn't no, that let me rephrase that. There was very quickly critical mass. People really did download it very quickly, but they didn't see any results very quickly. They saw nothing, because of all that happened at a time when Australia didn't have much COVID around. And because there was no payoff in that immediate period, people just, I think, lost interest in it.
Yeah. Thank you for sharing your perspective. I think all of us have some sort of user experience with these apps now. So that's really interesting to hear. I think that's also kind of the case where I was, in that there was substantial download initially, at least in my area, but because it was so hard to actually notify people, because you need a whole process to even get a code from, like, if you tested positive to notify the app, like, no one got notifications. So we didn't, at least I didn't perceive the benefits of it. Other folks in the audience, do you want to jump in and share your experience? Or you can put it in the chat. I think if no one wants to say anything, I can move on. So here are just some trade-offs that I have identified. Other folks have written about this in various academic papers. One trade-off that I think is quite interesting is in the US, at least, and in many countries in the EU that went with the decentralized architecture, one of the issues, especially in trying to figure out how effective these apps are, is that we don't have as much data to work with. And so a lot of the studies that I've shown requires a lot of modeling assumption, because they know how many people tested positive and how many notifications went out, but they can't really do any sort of network analysis. They can't identify, say, clusters of cases. So that is a trade-off from sort of public health perspective. And then, with the mandatory use that Kimberly versus voluntary use that Kimberly pointed out, there is this trade-off in terms of whether we should allow people to have greater autonomy over their data versus, if we make more people use the app or mandatorily report that they've tested positive, maybe that would increase the effectiveness. But as one paper, I think smartly pointed out, that is not really, in many societies that have sort of a lot of civil liberties, it's not quite feasible to require people to download an app or even say wear a wristband as you're required to do in Hong Kong.
Baobao, can I just raise a question? Just because
yes.
I came off watching Helen Nissenbaum talk before about contextual integrity and information flows, and I'm interested in that box you have there under sort of privacy and security and the mandatory use reporting. That idea that it could be considered a violation of privacy, and I'm wondering whether Nissenbaum's ideas around contextual integrity and the flows of data could help us kind of break that up a little bit and not treat that as just a binary, in the sense that it, the conveying of the information about, where you are or the ping or whatever it is that is going through these contact tracing apps, and the location knowledge, the location information that comes from that, like the flow of information for purely public health purposes might be considered appropriate, and consistent with norms and consistent with contextual integrity. But one of the things that, and sorry, I came in late, so I may have missed it. You may have talked about this, but one of the things that really harmed perceptions of the contact tracing app was when police used the information. Yes. And so you have that violation of contextual integrity, but the mandatory reporting isn't the problem. It's the sort of dual use of the information that's the problem.
Yeah, I think that's a really good point. And I'm going to go and watch Helen's talk. I unfortunately had another meeting during the time. So thank you for bringing up that point. And that's actually maybe it's the next slide. Yes, it is the next slide.
Oh, sorry.
You had anticipated where I was going to move to. And so I think this is a case where, or a few cases where I think are very concerning of this dual use of the data. So in Singapore, police had admitted to using the contact tracing app data, and the government actually allowed the police to use the app data for criminal investigations, which had led to a public backlash, but it is, yeah, that is definitely concerning. In some other jurisdictions, we've seen the opposite moves. Again, I tend to focus on where I do research. So in New York State, actually, the state government passed a law that says you cannot use contact tracing app data for any purpose other than contact tracing. So it prohibits this kind of use. So very different sort of legal regulation of how the data, in what cases data can and cannot be used. And in Men's Germany, there's another case where this was a app that had the location tracking. So it was a QR code that you can scan at restaurants. And the police had successfully petitioned local health authorities to release the data to contact witnesses to this crime where this person had been, I think he fell off a building or something. And so that was a case where, again, there was a lot of public backlash where the app developers actually told people this is bad, and some politicians said people should delete the app. And then more recently, this is, I think, a very disturbing case in Zhengzhou, China, where there were a bunch of investors who had lost money in a scam, and they wanted to get their money back, and they also wanted to protest. And the government, the local government, had turned these protesters' health code from green to red, which means that they can't enter the city or go to public places like to the bank to withdraw their money. So in this case, it was a very politicized use of this app to basically deter protest and to prevent movement. So when the protesters arrived, the police actually detained them and sent them away. So again, the protesters said, you know, our codes were green before we decided to go protest. And so this is a quite disturbing case. And here it's an app that is mandatory for use to move between cities in China. Moving on to another reason why I think the contact tracing apps kind of failed was that there's like this chicken and egg problem where there is this perceived lack of effectiveness, and then that leads to lower user uptake, that leads to lack of actual effectiveness, and it's kind of like a cycle. So adoption rates are relatively high in the EU. This is where I can find the most data on percentage of people who have downloaded these apps, but it's still not optimal, especially in a lot of countries that are sort of below, say, you know, they're in the teens or even below 10%. And this is something that we have studied, my team has studied in the US, where adoptions rates are quite low in the US. And there is definitely a political dimension to it. So anything sort of pandemic related in the US, we've definitely noticed this partisan divide, as perhaps many of you have heard. And here, what we find is that among Democrats, there's sort of a greater adoption rate. This is among the 28 states that have deployed apps by that time. And interestingly, what we found is that among both Republicans and independents, the use rates are very, very low. And one of the reasons is the public did not perceive contact tracing apps to be as effective as other interventions, say wearing a mask or getting a vaccine or physically distancing from others. And this is even true among Democrats. So there is this idea that it's perceived as not as effective. But another problem in the US is that a lot of people did not know about the apps. I think this is one of these cases where public health departments didn't really emphasize it as one of the slices in the Swiss cheese model. And we found that a lot of respondents in our survey said that they were not even aware that an app exists in their state. And then also, I think privacy, I think, is sort of the second most important reason. To just give you some sample of the open-ended responses that we got from our survey, a lot of people said, yeah, I wasn't aware that the app existed. What app? I wasn't aware that, you know, it's available. And then we kind of get other responses that said, you know, I don't want my data to be collected. I don't want to be tracked by the government. I'm concerned that the government can track every move, even though these apps, again, don't track location, but there is still this concern around, you know, how can I trust that it isn't tracking my location? And that is actually, you know, these people may sound like conspiracy theorists, but actually there was a loophole with the Android app where you had to turn on your GPS location tracking for the app to work. So Google finally turned it off, but for a while it required you to turn on GPS location tracking. So it's not as conspiracy theory thinking as you might perceive. And then there was a lot of perception that the app was unnecessary because, like, I'm vaccinated now, I don't need to worry, or I don't, you know, go out that much, so I don't think I need it. And then finally, I think the nature of the pandemic also changed contact tracing in general. I just think the more infectious variants basically overwhelmed contact tracing capabilities in many countries that have had these big surges. So just to give you sort of a context of sort of the R naught value, or basically how many people you would infect from one case. So the original wild type, it was the R naught value was 1.4 to 6.5, and then it went up to 3.2 to 8. And then with Omicron, then it's even more transmissible. It's like 3.2 times more transmissible than Delta. I don't think it's as infectious as measles, but it's like getting up there. And I think this, at least in the US, many public health departments were already winding down their contact tracing efforts. And then with this huge spike in cases, it was just not kind of feasible to do contact tracing. But also, I think understanding how the virus spreads might kind of really change the game around contact tracing, because what is considered a close contact really needs to be updated as we become aware that the majority of the spread is through aerosol, which means that it can go beyond 1 meter. It can float in the air for many hours. Maybe someone's been in the room and coughed or breathed out their air, and then you can walk in and still get infected. So it's not necessarily the sort of 1 meter, 15 minutes kind of close contact that a lot of these parameters on these apps set. It could, if you wanted to get more contacts, I think the definition needs to be updated, which gets to this big dilemma that those in the UK, you might be aware of the pandemic. And the problem is, if you have a stricter definition of close contact, you might, so closer distance, longer time, you might have lower false positive rates and prevent the pandemic, but a lot of contacts might be not notified. So that's the downside. On the other hand, if you really consider how COVID is spread nowadays, with a less strict definition of close contact, maybe over a longer distance, a shorter time, it's true that you can identify potentially more infected people, but you might get a higher rate of false positive, and a lot of people might unnecessarily need to quarantine. And I think the interesting case of the pandemic during the Delta wave in the UK sort of illustrates this dilemma, where a lot of people got sent notifications, so much so that a lot of essential workers initially were told to quarantine, but then too many of them were quarantining that it was a problem for essential services in the country. Like people were not able to, stores were unable to say, have people enough food or supplies on the shelves, or people's trash weren't being collected. And so there is this dilemma, right, where we do want people to quarantine, but if too many people are out of not going into work, then we're going to have like a breakdown of a lot of essential functions in society. And I felt this quote by Imogen Parker, the policy director at the Ada Lovelace Institute, made a great point where the quote is, while we had concerns about the justification for the contact tracing app, criticizing it for the pandemic is displaced. The app essentially was working as it has always been. So in some ways, yeah, the pandemic did a great job because the Delta wave was super infectious. But on the other hand, having that many people quarantining was leading to other problems, essential services not getting done. And this is a trade-off that we have seen again and again with these more infectious waves, where public health authorities have basically gone against the science in some ways. For instance, the US CDC had said that reduce the quarantine time from 14 days to 5 days, even though from a scientific perspective, a lot of people are still infectious on day 5, but you can't have that many people quarantining, or that you won't be able to have essential services unless it is a tricky dilemma. And I just want to conclude by saying that, unfortunately, with these new variants, I think it's just becoming very hard to do contact tracing. We've reached a point where in the US, the vast majority of children and those who are not elderly adults have become infected with COVID, especially during this Omicron wave. I think in the UK, it's like 80% of the population probably has become infected with COVID based on these serial prevalence testing of SARS-CoV-2 antibodies. So yeah, this is, sorry to end on a dire note here, but I think the nature of the pandemic has really outstripped contact tracing as a method of pandemic control. So I just want to end on a note it's kind of like ending on a rather negative note, but I do want to emphasize that I think despite this very negative experience, I think it's important to learn from it, given that pandemics, as I mentioned early on, might not be this one-off event, and we might experience other pandemics in the future. And so I don't know, by a raise of hand, how many of you lived through or remember the swine flu pandemic of 2009? That was my first year of undergrad, and I remember I contracted swine flu, which was not fun. And I'm just pulling up my notes here. I just thought it was.
I do remember the swine flu thing, but the funny thing about that was feeling like, certainly from Australia, that it wasn't a global problem, that it was confined to certain countries in a way that maybe made a few countries a bit more complacent this time around as well, thinking it wouldn't be a global problem again. I don't know.
Yeah, that's really interesting. Somehow, like, the US got really complacent, even though we had a rather large number of cases. So I'm just going to sort of read you this lessons from the front lines from the swine flu pandemic. The top 5 recommendations were maintaining the strategic national stockpile of antiviral medication, vaccinations, and equipment, vaccine development and production, to be able to rapidly produce a vaccine, vaccinating people over a short period of time. They asked for more planning and coordination among state and local governments within the US. And then the 5th one was anticipating school closings, sick leaves, and basically restrictions on public gatherings, so sort of the lockdown mitigations that some of us have experienced. So this was from 2009, and I guess a lot of this message sort of didn't get necessarily fully across to some governments that were either neglecting scientific evidence or just caught really unprepared. I'm going to try to do a activity with, I don't know if, let's see if this works. So I created this Jamboard. It's like a digital whiteboard, and I'm just curious to hear your thoughts about what recommendations do you have for the use of digital technologies in future pandemics? And this is, let me see if I can give everyone edit permission. I'm gonna give everyone edit permission, sorry. So if you just refresh it, I think you'll be able to add sticky notes to the Jamboard. I put some notes on there. Basically, what I've learned while working on this during the pandemic is that a lot of us, we were working under pressure, not doing a lot of, or trying to collect empirical data under pressure in cases where there were a lot of sort of ethical concerns. If we just had more time to prepare for it, or if someone handed us a guidebook from of all the lessons that they learned, that would be super helpful. So I think what I'm hoping to do with my team, and certainly if you're interested in collaborating with us, is to come up with a guide in terms of how we can anticipate instead of trying again to sort of do this in an emergency. Does everyone have edit access? If you, I think I gave everyone edit access now. If you just refresh it, you're able to add sticky notes.
I've found that, yes, it's working.
So I'm going to let everyone work for maybe 5 minutes and we'll come back and have a discussion. I'm gonna turn off my video. One thing I forgot to explain, or sort of two things I forgot to explain is, I kind of cut it up into different stakeholders or divided the board up into different stakeholders. But certainly if you're testing something at the intersection of stakeholders, feel free to put the sticky note sort of on the highlighted line. And the other thing is my team really cares about giving credit to folks. So if you want to be acknowledged in some way, feel free to put your name on the sticky note so that we know to thank you. Now I'm trying to figure out how to share the Jamboard. Oh, this is, it's like when people who study technology try to do stuff with technology.
I wouldn't worry too much. People can see that, people can go to the Jamboard and we can hear you as you speak. So I wouldn't worry too much.
That's good.
I can hear you fine. So if you wanted to talk to it, that's fine.
Wow, we're getting a lot of contributions. So I can't share the screen for some reason. So I guess if you're on the Jamboard, I can see your notes. So thank you for contributing. Instead of my just reading it out loud, which is what I usually do with my students when I do a Jamboard activity with them, does anyone want to, feel free to, I can add you and then you can explain your point and maybe sort of, I know a sticky note is not, it's kind of like tweeting. So if you want to share your thoughts in more detail, I'd love to hear it.
It's funny, I don't know if you can see me moving my note around at the moment, but this one on shiny new technologies, I wasn't sure where to put it. You know, it's almost a point that could be repeated across every sector. Maybe I should put it in the middle. Because one thing that bothered me in some of the debate around this was just the sheer amount of attention the contact tracing apps sucked up from the public discourse about what to do. Mm-hmm. Whereas, you know, basic things like let's work on air quality or let's work on masking or let's work on other public health measures just wasn't as exciting. It wasn't as newsworthy and it wasn't getting as much attention from politicians and others as it could have. I don't know. I could be wrong.
Yeah, I definitely think so. I think I'm glad that this conversation has died down. Although there's, yeah, I think in the beginning there was a lot of conversation, a lot of people working sort of within the technology space got sucked into the debate, for better or for worse.
I think that's my point, which is, you know, were there other debates those people should have been being sucked into? I don't know.
Do other folks who put sticky notes want to share their comment? And I can add you to the give you video and audio access.
Maybe if there's one of the sticky notes that you find most interesting, you could.
Yeah. So I really like the sticky note that says stress testing their products using worst case / adversarial methods in terms of engineering, from engineering perspective, which does anyone want to talk about that, or it just really appealed to me because in the papers that I was reading, a lot of the testing wasn't even using sort of worst case methods. It was more like, what if you have your phone in a bag? Or what if you're standing, next to a large building or under a tree? And that had consequences for the Bluetooth signal attenuation. So I thought that wasn't even sort of a worst case method. I'm gonna go to some other sticky notes. Maybe don't let the policymakers and the tech developers dominate the conversation in design. Yeah, I think that's a very key point. So early on, my team had been working. We thought about partnering with one of these developers at MIT, SafePath, which was one of the first sort of Bluetooth proximity tracing groups that came up with a prototype. And what kind of concerned us was that they were all engineers and not really public health people. And we were behavioral scientists, so we weren't exactly public health people as well. And one of the interesting stories I sometimes share is that oftentimes when these new technologies are being tested, because in the US, like the regulation was stricter, they decided to go to Guam as their sort of field test. And my team didn't quite feel comfortable helping them with that because, first of all, we just don't know the local context. And second of all, it seemed kind of like neocolonialism, like we can just test it in a place that doesn't have the same protections for the participants.
Oh, that's really interesting. Actually, in the Q&A...
Pardon me?
In the Q&A, I actually put a question. Are the problems with the contact tracing apps a sign of miscommunication or misunderstanding between disciplines? So public health, tech, sort of not having the same goals or understanding of what's important? Or are they just evidence of that the focus on technology as a solution was misdirection? Is it a disciplinary problem? Did you notice that as you were working on these questions?
Yeah, I think so. I think it was given that a lot of these early designs were coming out of universities before it kind of went to Google and Apple. From that perspective, it was a bunch of engineers coming up with an idea, and then they were not really, co-designing with, say, public health people. And they were just sort of bringing people on as they kind of move towards testing. And I think if they had, come talk to us behavioral scientists from day one, or public health people, to just, as I mentioned, setting the parameters matters a lot, right, in terms of false positive and false negative rates. But I think that conversation was sort of sidelined until a bit later. So,
and it's funny because my immediate instinct on that is, but the public health authorities are really busy for obvious reasons. But then I thought about that a bit more, and I thought, well, actually, there's public health experts in all the universities, and behavioural experts like yourself in all of the universities who could have helped with some of those questions. So it does speak to the importance of the interdisciplinary nature of the team.
Exactly. Yeah, one thing I gave this talk to a bioethics group at Penn, and I think the public health communication person for the state was there, and she said that they wish they had thought about public health communication around their apps much earlier, because that was actually a problem where they had developed the app and they just didn't know how to communicate about it, which is, it's one of those things like, I wish there were a playbook of sorts where you can anticipate all the expertise that you might need instead of saying, oh, we have a thing, a product. Now, how do we get people to use it?
Actually, that's really interesting, because the messaging, because I was also, when I was looking at your Jamboard, I was trying to think where, like, what do we say about civil society or like those public interest groups, like that part of it. And maybe because one of the things that could have been anticipated, probably should have been anticipated, is you bring out something like a contact tracing app and all the privacy advocates are going to jump up and down and say, this is disaster. And like working through, even with those groups, how to manage that might have been really helpful. Like even by saying, look, we really want to do this, but we want it, we'll do a 6-month moratorium. Just can we do it now without being like completely attacked, so that the public messaging doesn't get all muckied up? Like you can imagine like going through some scenarios where you could say, okay, like what are the baseline things we absolutely have to have as privacy protections before you won't attack us into the ground? But now I'm just multiplying the team.
Yeah, I think that's a good point. I think that a lot of public health authorities were maybe they were kind of hesitant to market it too much because of concerns from civil society groups very early on. And also, given that it's uncertain that it will be effective, unlike the vaccine that has been rigorously tested, you can market all you want and do the PR. But I think there was a real hesitancy where, is this really effective? Is it as privacy preserving as it's claimed? I think there was definitely a hesitancy around marketing it when there was this uncertainty, and a lot of civil society groups saying like, this is not going to do anything. So maybe it's like a self-fulfilling prophecy in a way. Do other folks have? Oh, go ahead.
I was just going to say, we have about 5 minutes before the keynote will start in hybrid mode. So you might, just letting you know.
Yes. Any other questions? I can let you go early and have a bio break before the keynote. So I'm going to give you maybe 30 seconds. Kimberly, thank you so much. This is really helpful. And thank you everyone who's contributed to the Jamboard. This is great.
I found that really interesting. Thank you.
I think we don't have any more questions, so I'm going to let you have a bit of a break before the keynote. Take care, everyone. And sorry for the technical difficulty in the beginning. Bye.